Is Ariane Rung, Dr. Ariane Rung, and she is an associate professor at Louisiana State University's Health Sciences Center, School of Public Health, and that's in New Orleans. So she's going to be talking a little bit about the women and their children's health study. And you remember when we put that slide up, one of those boxes of the ongoing work was the Deepwater Horizon Research Consortium. So this is one of the programs that's funded under that. So it's all yours.
Great. Okay, good morning. So, sorry, get situated here. Okay, so I'm Ariane Rung, and I'm going to talk about the WATCH study, which is, as Larissa mentioned, the Women and Their Children's Health Study. We were funded by NIEHS to look at the health effects of women who have been exposed to the oil spill, the Deepwater Horizon oil spill. I'm not going to explain what that is. I think we all know. One of our aims was to look at women. The other was to look at children. I'm not going to talk about the children so much today, and I'm also not going to talk so much about the physical health effects that we've been looking at, but I'm really going to focus on the mental health. So just briefly how we conducted the study, we were interviewing women in those 7 southern coastal parishes of Louisiana that you can see highlighted on that map there of Louisiana. We did 2 waves of data collection. The first wave happened between 2012 and 2014, and then our second wave we just finished earlier this summer. We had about 2,800 women that we interviewed, and then from those women, we went and visited another 1,200 women at home and did additional interviews with them, collected blood samples and so on, and we also interviewed another 600 children of those women as well. And then for our second wave of data collection, we went back to those same women that we originally interviewed, and we got about over 70% of them for the second time. I'm going to just focus most of the talk on data from wave 1. Wave 2, as you see here, we just finished this summer, so that's we're still in the process of looking at that. Very briefly, this is what our sample looked like in terms of race. 56% of our women were white, 35% black. 71% of them had a high school education or less, and 46% of them had a pre-oil spill household income of less than $40,000 per year. And then most of them, 63%, were currently married or living with a partner. So one of the things that when we do research on oil spills is we have to figure out how exactly are we going to measure exposure to the oil spill. And this has been a big challenge for us, and I think many of the studies that are looking at the health effects is how do we actually quantify this? We didn't have anything, any sort of air samples, there aren't any biomarkers that existed that could tell us how much oil an individual had been exposed to. So we were relying primarily on questions that we asked in our survey. And the questions that we used were many of the same ones that were used in the Exxon Valdez research, and we added a couple of our own. And we were able to use statistical processes to divide up the 9 questions we were asked into 2 groups. So the first group was what we called economic exposure to the oil spill, and so this had to do with whether people had lost income due to a job disruption or the closing of a business because of the oil spill. We found about 26% of our women had experienced that. We also asked them a comparison question, whether they felt they had been hit harder by the spill compared to others in their community. 6% said yes. And then we asked whether they felt the oil spill had a somewhat or a very negative influence on their household finances, and 36% said that they had. So those 3 questions together composed what we refer to as economic exposure to the spill. And then we asked another series of questions about more of their a direct physical or environmental exposure to the oil. And so these had to do with whether the oil spill caused damage to areas that they fished commercially. 7% said yes. Whether they could smell any oil. 38% of our population said that they could smell it. Whether they had come into other kinds of physical contact with the oil, 22%, whether it directly affected their recreational activities, whether this was hunting or fishing or swimming, those kinds of things, 34% said yes, and then under 5% each had said that they had worked on cleanup activities or that they had property damaged from the oil spill or from cleanup activities. So those 6 questions together formed our measure of physical exposure to the oil spill. Okay, and then we looked at several different mental health outcomes. We looked at depression, which was measured about their feelings in the past week, during that week that they were interviewed. We looked at mental distress, which is, this is the K6 measure, which is considered a proxy for severe, for mental illness. We also looked at a couple of markers of domestic conflict. We asked women whether they had felt that they had experienced an increase in the number of fights with their partner, with their household partner, whether their husband or their live-in partner, or whether the intensity of fights with their partner had increased since the oil spill. And then at wave 2, we also asked questions about post-traumatic stress disorder, and we used the PCL-5. So for those of you who are familiar with it, this was questions based on the newer definitions of post-traumatic stress that came out recently with the DSM-5. We also asked them questions from the life events checklist to help identify what particular exposures they had been exposed to over their lifetime in terms of trauma. And again, we only asked those in the second wave of data collection. So this slide here will just give you an idea of what kind of prevalence we were looking at wave 1. So you can see here that about 28% of our sample of women reported that they had depressive symptoms in the past week. So for comparison purposes, you would normally expect to see about 20% of the population nationally have a score in this range. So we were already a little bit higher. In terms of mental distress, we broke it down into 3 groups. We had severe, moderate, and none. So 13% of our sample reported that they had experienced severe mental distress in the past month, and then another 19% talked about moderate amounts of mental distress. So this is, both those things are obviously somewhere above none. 16% of our subjects said that they had experienced an increase in the number of fights with their domestic partner, and then 11% had talked about an increase in the intensity of fights with their domestic partner. Let me get to PTSD in a minute. So this slide shows us the relationship between these different mental health outcomes and economic exposure. So that economic exposure was what I talked about, job loss, income loss, and so on. And so any of these lines that are kind of, any of the green lines that don't cross that one line, that one horizontal line, are all showing that there are significant relationships with economic exposure. So basically, depression, domestic conflict, and PTSD were all significantly associated with increased economic exposure. And then we did a similar thing with physical exposure, and here now we see that all of our mental health outcomes they're all clearly above that 1.0 line. They were all associated with increased physical exposure to the oil spill. And then just to spend a couple seconds talking about post-traumatic stress disorder. So again, this was measured at our wave 2, so it was assessed about 4 to 5 years after the oil spill had occurred, so sometime later. We had asked women about the different kinds of trauma that they had experienced. 52% said that they had either experienced or witnessed the Deepwater Horizon oil spill. 39%, just as a kind of refresher, reported that they had been able to smell the spill at the time, and then 26% reported that they had experienced some income loss related to the oil spill as well. And then another 33% said that it had a negative effect on their household finances. So when we looked at post-traumatic stress disorder itself, from the, this was from the PTSL, you get a score. We had a mean score of 15.6. You can score between the ranges of 0 and 70. If you establish cutoff threshold of 38, which is kind of what people are working with these days. Anybody who scores above 38 would be considered to have PTSD. We found 13% of our women scored in that range. In terms of the number of trauma categories that they endorsed on the checklist, the average woman endorsed about 6 different traumas, 6 different trauma categories. So if you want to compare that to what we would expect to find in our national population, we would expect to see about 3.3 trauma categories endorsed. Here we're seeing 6, so again, it's high. What were they endorsing? Well, we're talking about southern Louisiana, so many of them obviously said, probably almost all of them reported natural disasters. They also reported transportation accidents and life-threatening illness or injury. So how is their post-traumatic stress disorder related to exposure to the oil spill? So again, we are kind of still working on this aspect of our data, but in this particular instance, we combined exposure. We combined both economic and physical exposure just into one score. So we looked at overall total exposure, and that we found that our mean scores of PTSD did increase with higher levels of exposure. So the far left category, they had no exposure to the Deepwater Horizon oil spill, and you can see their levels of PTSD on the y-axis, and then as you increase exposure, you can see progressively higher levels of post-traumatic stress disorder. So what have we concluded so far from this? One is that we do have a fairly high prevalence of poor mental health outcomes, even 2 to 5 years out from the oil spill among women in southern Louisiana. We've noted that there is greater physical and economic oil spill exposure that's associated with depression, domestic conflict, and PTSD, and then we've seen that just physical oil exposure is associated with greater mental distress. So kind of the next question that we've established that there are these relationships between exposure to the oil spill and mental health, but now the question is why? How is this working? What are the pathways between oil spill exposure and depression in particular? And we're still in the process of looking at some of these things, but we've looked at the neighborhood environment and we've looked at social ties. So let me just talk to you a little bit about each of those efforts. So the neighborhood pathway, so this has to do with the neighborhoods that women live in, so the environments where people live. So we're talking about things like neighborhood conditions, like economic disadvantage in the neighborhood, the physical disorder that's in the neighborhood. We've seen in other literature that these things are often stressors that are associated with mental health and in particular depression. So women who live in neighborhoods that are of poor quality or poor condition often tend to have higher levels of depression. So the question that we had then was, is that oil spill depression relationship that we saw stronger among those who live in a poor quality neighborhood environment? And so we looked at this among a subsample of our women that had a home visit at our first wave of data collection. We defined the neighborhood environment in a couple of different ways. One is we looked at the census data that was associated with the census tracts that our women lived in, and these are commonly used measures of economic disadvantage at the census tract level. So it was things like proportion of Black residents, proportion renter-occupied housing, proportion unemployed, proportion of families living below the poverty line, and so on. And so that was a measure created to the neighborhood economic disadvantage. Then one of the other things that we did to describe neighborhood environments was when we went to women's homes, we actually looked at their neighborhood environments. We had a little checklist, an audit form, and we walked up and down the block they lived in and kind of checked off things about whether there was abandoned housing and litter and cars and that sort of thing. And so from there, we came up with 2 more measures of neighborhood environment. One we called litter, and that had to do with whether there was a certain amount of empty beer bottles on the ground, cigarette butts, garbage and litter on the sidewalks. And then another construct that we defined that we called signs of community decline, which had to do with whether there were abandoned cars or abandoned buildings or graffiti that were observable on that block. So what we found here was, to just kind of going back to looking at the relationship between oil spill exposure and depression, we did find that being physically exposed to that oil spill was predictive of depression, both at our wave 1 and our wave 2. And then we found that economic exposure seemed to be related only at wave 2. So this was a little bit different, a little bit new, that this relationship was much stronger a little bit farther out from the actual oil spill itself. So then we looked at the relationship between the neighborhood environment and depression, and we found that the characteristics of the neighborhood that we measured through the census data at the census tract level were not predictive of depression at all. So we were a little bit surprised about that, but that was not associated. We did find that the levels of community decline, so this was the measure where we looked at whether there were abandoned cars and buildings and graffiti, that was predictive of depression, but that was only at our first wave of data collection. And then litter wasn't predictive at all. So then we were looking at whether somehow being in a neighborhood with these poor conditions, poor community decline, somehow affected that depression exposure relationship, and we found that physical exposure to the Deepwater Horizon oil spill was associated with increased depression only among women who lived in areas with greater signs of community decline. So then the second pathway that we explored was the social pathway. And so this we've talked a lot about already with David's presentation and Dwayne's earlier. We've seen that there is this relationship between disaster exposure and mental health consequences, in particular depression, but we don't really understand why that's happening. Is it because the economic consequences of the oil spill lead to increased job loss and thus increased stress, which then lead to poor mental health? Or is there something else going on where in the aftermath of a disaster that leads to deteriorated social ties and then that subsequently leads to poor mental health? So when we're looking at social ties, what do we mean by that? We're talking about how people socialize, how they live, how they interact and relate to each other. And why did we choose that? Well, if you weren't convinced by what the previous two presentations showed you, there actually has been a lot of evidence in the literature that links social ties to health, and in particular mental health. So specifically, what did we look at? We looked at social capital and social support. By social capital, we are referring to the degree of connectedness and the quality and quantity of social relations in a given population. We further subdivided that into two different components: structural social capital and cognitive social capital. So structural social capital has to do with how people are linked together, the extent and the intensity of their associational links, or it's kind of the shorthand for it, what people do in terms of social relations. So we operationalized this in our study by asking people about the number of neighborhood organizations that they participated in during the past year. And so that's our structural social capital. The other component of social capital is cognitive social capital. So this tends to be how people feel about their social relations. So it has to do with things like reciprocity, mutual trust, sharing of values, those kinds of things. We measured that in our study through two things, through something called sense of community and informal social control. So these questions were about how people felt their neighbors would react in similar, in different scenarios. Say, for example, whether children were loitering in front of their house, how would the neighbors react to that? How they felt about living in their community, whether they felt it was a good place to live, and so on. So those kinds of questions made up the cognitive social component, cognitive social capital component. And then the third thing we looked at was social support, and again, this just has to do with helping behaviors, how people relate to their family and friends, whether they can get instrumental support or emotional or even financial support from those kinds of people. So here's what we found, and I know it's very complicated and you could spend hours kind of looking at it and all the different relationships, and I have, but let me just try to highlight some of the key components of this particular model. So we call this a structural equation model, where we basically plug everything, into our software and create a model that has a good fit, and then look at the relationships that it shows us. So the first thing that I want to point out to you here along the bottom is basically the process of how social capital is operating. So what we've seen is that structural social capital, so these were people's participation in neighborhood organizations, that kind of thing, led to increased cognitive social capital, so it led to greater feelings of belonging, of participation, of mutual sharing and trust and so on. Which then led to greater feelings of social support. Okay, so that process, happened in a very particular fashion. And then ultimately, social support led to, if you had higher levels of social support, you tended to have lower levels of depression. Then in the top part of this model, we can see actually what was happening as a result of the Deepwater Horizon oil spill. So here we see that physical exposure to the oil leads to increased economic consequences of the oil, which then leads to, well, this was not significant, current unemployment. So we actually did not find that economic consequences led to current unemployment. What we do see, though, is that, and you don't actually see it in this particular slide, but economic consequences are associated with depression. So the more economic consequences experienced by people, the higher levels of depression. But once we took into account all these other things in the model, that association went away. So what we're seeing now is that there was something else explaining the relationship between economic exposure to the spill and depression. And it is not current employment. So what was it? Well, it was these two things down below, cognitive social capital and social support. So we saw earlier that social capital and social support, higher levels of those led to reduced levels of depression, but once you factor in the economic consequences of the oil spill, you see that these economic consequences basically are associated with less social capital and social support. So somehow the economic consequences are eroding these beneficial effects of social capital and social support, and in fact, 67% of the relationship between economic exposure and depression is explained by these two things of cognitive social capital and social support. So just kind of in summary, what we saw with that model is that social capital exerts its influence on depression via structural social capital, cognitive social capital, and social support, that the social context is protective against depression, but also is negatively affected by the oil spill disaster. And so for those of you who like to, see what theories this actually supports, there is a theory that is very much explains this, called the social support deterioration theory, whereby we can see that the disaster erodes those beneficial effects of social support, and also we've added to this social capital, and so that accounts for that negative effect of exposure on depression. So what are the implications of this? Well, obviously we need to focus more on the social context to see whether there can be things to bolster that to help mitigate some of the mental health effects of disasters. Okay, and then this is, I just want to acknowledge my co-investigators and our research staff, and also the women who have so kindly donated their time to participate in this study. Thank you.